If you've stayed awake at night wondering what's happening to your body, is that vaginismus or are your symptoms somehow different? Then this video is for you. I'm going to give you 5 signs, not a checklist, not a quiz that you find on wellness blogs, but 5 clinical signs that I look for in my patients in the clinic that tell me exactly what is going on in their body. And by the end of this video, you will know too. Hi, I'm Dr. Darshana. I am a doctor of physical therapy, a dual board certified pelvic health expert, and vaginismus is the only thing I treat in the clinic. I wrote a book about it, I gave a TED talk about it, but what is more important for you to know is I have sat across from thousands of women who are feeling the same things that you're probably feeling, who had the same questions that you probably have. So let's get into it. The 5 signs. Okay, but before I go there, I just want you to know if you're dealing with this, if you're ever wondering, is my body normal? I want you to know that this is a fixable problem. Okay, this is not hope, this is clinical facts. This is a fixable problem. So let's get into the 5 signs. Number 1, it feels like involuntary closing. Okay, you're in the mood, you have tried relaxing, you've tried wine, you've tried different positions, you love your partner, you've had a chill day, you've taken a shower, you've done it all. And yet, when time comes for something to enter your body, penetration, your body just involuntarily closes down. The thing I need you to understand, the key word here is involuntary. That means it is automatic and you can't control it. It's sort of like if some object is coming close to your eyes, you're going to blink, right? You cannot relax your way out of it. It requires a different approach because it is an automatic response, right? That is that involuntary closing of your body. The second sign I often find is inconsistency, meaning some days you can use a finger, some days not so much. Some days you're working on a size 3 dilator and other days you feel like you have regressed all the way. Some days you feel like your body isn't fighting an all muscle battle. Other days your even jaw is tight. That inconsistency is frustrating. It makes patients feel often, what is going on? Like, why this is not making sense. But inconsistency is actually very important clinical information for me. Inconsistency tells me that your muscles are not the bigger problem, your nervous system is, because the only variable here is nervous system. The context, what's going on in your mood, what's going on in that day matters, right? And that's where we need to address so we have better solutions. So inconsistency, while that's frustrating, to me, that is clarity. It tells me the variable that is not being addressed is the nervous system, right? And not just like tight muscles, okay? The third sign that I see is relaxation doesn't work, right? Because relaxation is a conscious activity. You have to try to relax. And how many of you have felt like tightness or pain with penetration or pain with sex and fear of penetration, and you've already tried relaxing? You have, right? Like you've tried breathing, you've tried powering through, you've tried meditation, you've tried everything. But the thing is, relaxation is a conscious activity, and what we're getting is an automatic response, right? That's why relaxation doesn't work. Like it's like if you're blushing, right? Like if you something embarrassing happened and your face is becoming all red and blushing, and I told you I need you to relax and not blush. Can you control that? You can't, because it is automatic, right? What it requires is nervous system re-regulation, creating different pathways, creating different strategies so your brain has alternate way of responding and not just clenching, right? So that's the third sign, that relaxation, you've tried it and it just does not work, okay? Sign 4, everything else is fine and normal. You have a great family, you've not had any trauma, you've not had surgery, there is no disease, your parents are lovely, you don't have any history of any abuse or assault, you love your partner is patient, nobody is forcing you, hormones are fine, everything else is fine. Which makes it even more frustrating for my vaginismus girlies as to why is this happening? What is the problem? Because human nature is we want to find a problem. We want to find why this so we can go back and fix that. And I get it. But But if you're otherwise normal and it's just that response, that is very good news for us because that tells us the target is narrow. That tells us your pelvis, your body, your organs, your everything works fine, except when it's penetration, when it's something trying to go inside your body just locks down. That means the target is narrow, which means the treatments are usually narrow and work very well and are very effective, right? So the fact that everything else is normal is good clinical information for us. And that's actually a lot of hope, right? And last, and the most common symptom or sign that I hear from people is it feels like a wall, right? Some people experience pain, some people experience only tightness, but most of them experience this lack of space, right? It almost feels like they're hitting a wall. Sometimes they even wonder, maybe there isn't a hole there, right? Like maybe my anatomy is just different and I'm missing a hole, right? And then you've gone to the doctor, you've seen a gynecologist, and they look down there and they tell you everything is normal. But yet you, and often partners, feel that it's just a wall. I just feel like I can't go any further. It's a wall. That is that muscle clenching, muscle guarding, right? And that wall sensation tells me that muscles are overprotective. Muscles have experienced this same pathway so many times that now they are becoming clenched and guarded even before penetration has happened, which is what creates this sensation of wall. So what we need to do is break the association of penetration equal to pain and use certain tools that rewire that pathway so the muscles don't create a wall that you're experiencing, right? So that's it. Those are the 5 signs, right? You feel like your body involuntarily closes down, right? You feel some inconsistency in your symptoms. You are otherwise normal, no real medical problems or diagnosis going on. You feel like relaxation just doesn't work, like that just doesn't cut it for you. And last, your partner or you have felt this sensation of a wall, like hitting a wall, like a complete closure. If that resonated, if that felt like I'm talking about you, then chances are what you're dealing with is vaginismus. But the good news is you are normal. Nothing's broken. You were just not given complete information and a plan that works. Once we have the information, once we have the steps, this is a very fixable problem. I have seen so many clients over the years that have gone through nothing goes inside. In fact, I don't even know where my vagina is, to having pregnancies and vaginal deliveries the old school way, right? So this is possible. And like I said, this is not hope. These are clinical facts. The fact that this has a diagnosis and a treatment protocol and a success rate that I'm reporting, this is a fixable problem, right? Now, if this video gave you clarity, if it told you more about what's happening to you, gave you name for your condition and a plan for what to do next, please subscribe, because in the next videos, I'm going to go into deeper depth about this. I'm going to talk about what does your culture have to do with vaginismus? What does your religion have to do with vaginismus? What does your upbringing have to do with vaginismus? What does the world have to do with your vaginismus? And that content is going to be very helpful for you if you resonated with what you heard today, right? 16 years in the clinic, a book, and a TED Talk, all that, so you know exactly where to go if your private parts are not keeping up with the life that you want for yourself. I'm Dr. Darshana, and whole health is whole you.